Hey everyone, and welcome back to the channel. Today, we're diving into a topic that's surrounded by myths, whispers, and a whole lot of curiosity. We're talking about intimacy, but we're stripping away the guesswork and bringing in the science. We've gathered insights from medical experts, doctors, therapists, and researchers to uncover the real truths about what happens in the bedroom and how it impacts our overall well-being. This isn't about gossip. It's about understanding our bodies and relationships better. So, get comfortable, and let's separate fact from fiction. First up, let's talk about the brain. You might think intimacy is all about the physical, but neurologically, it's a massive event happening inside your head. When we engage in intimate acts, our brains release a cocktail of powerful neurochemicals. Dopamine, the feel-good neurotransmitter, floods our reward circuits, which is why intimacy can feel so pleasurable and even addictive. Then there's oxytocin, often called the cuddle hormone or bonding hormone. It's released during physical touch, from holding hands to more intimate contact, and is crucial for building feelings of trust, attachment, and deep connection with a partner. This isn't just fluffy romance. It's tangible brain chemistry that strengthens relationships. So, when you feel closer to your partner after being intimate, that's science at work, literally wiring you for connection. Now let's bust a common myth. The idea that there is a normal amount of intimacy everyone should be having. Experts are unanimous on this. There is no magic number. What's healthy and normal is what feels right for you and your partner. The pressure to meet some imaginary quota can actually create anxiety and stress, which are major mood killers. Communication is the key. A couple who is intimate once a month but is happy, connected, and communicating openly is in a much healthier place than a couple doing it more frequently out of a sense of obligation. It's about quality, not quantity. The goal is mutual satisfaction and connection, not hitting a scoreboard. So, let go of the comparisons and focus on what works for your unique relationship. Moving on, let's explore the incredible health benefits of a healthy, intimate life, which go way beyond just feeling good in the moment. Did you know it can be a fantastic stress reliever? Intimacy can lower levels of the stress hormone cortisol. That feeling of calm and relaxation afterward is a real physiological response. It also boosts your immune system. Studies have shown that people who are regularly intimate have higher levels of immunoglobulin A, an antibody that helps fight off common colds and infections. And what about heart health? It absolutely can be a form of moderate exercise, raising your heart rate and improving circulation. It's not a replacement for your gym routine, of course, but it's a wonderful, and far more enjoyable, supplement for your cardiovascular health. Let's also address the connection between intimacy and sleep. If you've ever felt incredibly sleepy after being intimate, you're not alone, and there's a scientific reason for it. The release of oxytocin and another hormone called prolactin promotes relaxation and drowsiness. For many people, it's nature's perfect sleep aid. This is particularly pronounced in men, but women experience this relaxation effect as well. So, if you're struggling to unwind at the end of the day, connecting with your partner might be a more effective and more pleasant solution than counting sheep. It's a natural, healthy way to prepare your body and mind for a restful night's sleep. However, it's not always smooth sailing. A huge part of the conversation that experts emphasize is desire discrepancy, where one partner wants intimacy more often than the other. This is one of the most common issues couples face, and is incredibly normal. It's not a sign that your relationship is doomed or that someone is broken. Desire ebbs and flows throughout our lives due to stress, fatigue, health issues, and hormonal changes. The solution isn't about one person giving in. It's about empathy and open, non-judgmental communication. Talk about what's behind the change in desire. Is it stress from work? Feeling disconnected emotionally? Sometimes, the path to reigniting physical intimacy starts with strengthening the emotional bond outside the bedroom. Speaking of emotional bonds, let's highlight the role of communication. Medical experts and therapists agree that the most important intimate organ is the 6 inches between your ears. Being able to talk openly about desires, boundaries, and what feels good is the foundation of a satisfying intimate life. This can be awkward at first, but it builds trust and deepens intimacy on all levels. It's not just about talking during the act itself, but creating a safe space in your relationship where these topics can be discussed without fear of judgment. Remember, your partner isn't a mind reader. Voicing your needs and listening to theirs is the ultimate act of love and respect. Another crucial aspect is understanding how our bodies change over time. From puberty through parenthood and into menopause and andropause, our hormones are on a lifelong journey, and they have a massive impact on our libido and physical responses. For women, hormonal shifts during the menstrual cycle, pregnancy, and menopause can significantly affect desire and comfort. For men, testosterone levels naturally decline with age. This is not the end of intimacy. It's simply a new chapter that may require adaptation. This could mean using lubricants, exploring different types of touch, or focusing more on emotional and sensual intimacy rather than just one specific act. Acknowledging and adapting to these natural life stages is key to maintaining a fulfilling intimate connection for decades. Let's also touch upon the psychological aspect of body image. How we feel about our own bodies can have a profound effect on our desire and confidence in the bedroom. Negative self-perception can create a mental barrier, making us feel self-conscious and unable to relax and enjoy the moment. Experts stress the importance of self-compassion and shifting the focus from perceived flaws to the sensations of pleasure and connection. A supportive partner can make all the difference here, offering reassurance and celebrating your body as it is. Remember, true intimacy thrives on vulnerability and acceptance, not on achieving an unrealistic physical ideal. Your worth is not defined by a number on a scale or a reflection in the mirror. So, what are the key takeaways from the experts? First, intimacy is a vital part of human health, benefiting our minds, bodies, and relationships. It's a powerful tool for connection, stress relief, and overall well-being. Second, there's no universal normal. What's healthy is what is consensual, respectful, and mutually satisfying for you and your partner. Ditch the comparisons. Third, communication is everything. Talking openly about needs, desires, and challenges is the bedrock of a healthy, intimate relationship. And finally, be kind to yourself and your partner. Our bodies and desires change over time, and that's okay. The journey is about adapting and growing together. Understanding the science behind intimacy demystifies it and empowers us to build healthier, happier relationships. It's not a taboo subject. It's a fundamental part of the human experience that deserves to be understood with clarity and compassion. Thank you so much for joining me for this important discussion today. I hope you found this information helpful and empowering. If you did, please give this video a thumbs up, and don't forget to subscribe and hit that notification bell so you don't miss our future content. What topics would you like us to explore next? Let me know in the comments below. Stay curious, stay healthy, and we'll see you in the next video.